This growing need for specialized supportive places outside of a hospital, or even just being at home all the time. What's really interesting here is how PPECs step right into that gap. They kind of bridge intensive medical care with a more, well, normal and enriching childhood experience.
Okay, so to really get the impact, we need to define it first. What is a PPEC? Exactly. When we talk about a PPEC, maybe think of it like a highly specialized medical daycare. Is that fair?
That's a good starting point. It's a non-residential facility, so kids don't stay overnight. But it's specifically designed for children with complex medical conditions, a place where they can get continuous expert medical care and support all day long.
So purpose-built for these kids to thrive.
Exactly. And the range of kids served, it's actually quite broad. PPECs are for children from birth right up to age 21 who are medically or technologically dependent. So that covers a really wide spectrum. We're talking kids with breathing needs. Maybe they have a tracheostomy or need a ventilator or oxygen. It also includes kids who need feeding tube management, like NG tubes or G tubes,
Right.
And also children with seizure disorders, neurological conditions, lots of different genetic syndromes, other chronic illnesses. The really key thing, though, is that they have to be stable enough for outpatient services, medically stable.
Got it. So stable, but needing that consistent medical oversight during the day.
Precisely. It lets kids with dozens of different complex conditions be in a more social, more stimulating setting than maybe they'd get at home or certainly in a hospital.
And the structure sounds like it offers real substantial support, attending up to 12 hours a day. That's significant.
It is. It offers a very robust level of daily care, not just for the child, but crucially for the family, too.
It's more than just a safe place, then. It's like a hub.
Absolutely. A hub of comprehensive support. The core services are really designed to cover all the bases.
Right.
First off, you've got the expert medical care. These places are staffed continuously by pediatric nurses, other medical folks trained in complex pediatric care. They handle medication, vitals, wound care, managing chronic conditions, all of it.
Okay.
Second, and this is huge, comprehensive therapy services are often right there, on site.
Oh, wow. So no running around to different appointments.
Exactly. Physical therapy, occupational speech, respiratory, feeding therapy, sometimes even behavioral therapy. It's all streamlined. Then there's personal care support, help with daily living activities. And beyond that, they integrate developmental and educational activities, tailored, age-appropriate play, learning support, mixed right into the day.
And support for the parents, too.
Yes, often crucial caregiver training and education for families is part of the package.
That sounds incredibly thorough, but I know parents listening might be thinking, okay, but how is this really different from what I'm doing now? Or maybe from the regular daycare I looked into, or the home nurse I had. Let's really unpack those differences. What makes a PPEC stand out?
Yeah, the distinctions are really impactful. Let's start with traditional daycare. A regular daycare just isn't equipped for medically complex kids, right? They don't have the staff, the training, the setup. PPECs, though, are built specifically for these needs. They have licensed medical professionals there all day, providing skilled nursing care, integrating therapies. It's a whole different world from typical daycare.
Okay, that makes sense. What about comparing it to home nursing? A lot of families rely on that.
Right, and home nursing can be wonderful, but PPECs offer some distinct advantages there too. One of the biggest is continuity and consistency of care. Think about it. In a PPEC, your child has a consistent team of professionals. They get to know your child incredibly well, their specific needs, their baseline.
Ah, so not different nurses rotating through all the time.
Potentially, yeah. Home care can sometimes struggle with staff changes, or worse, cancellations that leave parents in a real bind. A PPEC offers that day-in, day-out reliability, and that often leads to better health outcomes, even fewer trips to the emergency room.
Okay, consistency is huge. What else?
The integrated therapies.
Yeah.
We touched on this, but it's worth stressing. Instead of juggling, 3 different therapy appointments across town, figuring out transport, coordinating everything.
Which is exhausting.
Totally exhausting. In a PPEC, the physical, occupational speech therapies, they're right there, on site. It means more frequent sessions usually, way better coordination between the medical team and the therapists, and often that translates to faster progress for the child. It just removes so many logistical headaches.
I can only imagine the relief that provides. But what about the non-medical side, the kids stuff?
Yes. This is where a PPEC truly shines, I think. The socialization and developmental support. In a PPEC, children are interacting daily with other kids who might have similar experiences or challenges.
So they're not as isolated.
Exactly. It reduces that isolation that so many medically complex kids feel when they're mostly at home. They get to participate in age-appropriate things, sensory play, music, group activities. It helps build crucial social skills, emotional development. We've even seen things like a child starting to eat or drink by mouth, simply because they saw their peers doing it. That peer modeling can be incredibly powerful.
Wow, that's amazing.
It really is. And finally, let's not forget the family support and respite. Caring for a child with complex needs. It's a 247 job, physically, emotionally. Knowing your child is safe, happy, and getting expert care for up to 12 hours a day. That gives parents time. Time to work, time for other kids, time to just breathe. Rest.
It reduces that constant stress.
Dramatically. It lessens the caregiving burden significantly, which is just essential for the whole family's well-being.
Okay, it's really clear that PPECs offer something unique. So for parents listening thinking, could this be for my child? Let's revisit who typically qualifies.
Sure. So generally, you'll need a referral or a prescription from your child's doctor. The child needs to be medically or technologically dependent, meaning they require ongoing nursing care, therapies, that sort of thing.
And the age range again.
Birth up to 21.
Yeah.
So it covers a long span of childhood and young adulthood.
Right. This really makes me wonder, why does this matter so deeply? It feels like it goes way beyond just managing symptoms.
Oh, absolutely. The impact is profound. For the child, first you see holistic development. It's this blend, medical care, therapies, social interaction. It all works together to support their physical, emotional, social, and cognitive growth. They get a chance to just be a kid, explore, learn, but in an environment that's completely safe and equipped for their needs.
Giving them back some of that childhood experience.
Exactly. And beyond that, you often see demonstrably improved health. That consistent medical oversight, the coordinated care, it leads to better health outcomes. Fewer hospital readmissions, fewer ER visits, like we mentioned. And we see kids hitting significant milestones, walking, better balance, feeding orally, communicating more effectively, things that might have been much harder to achieve otherwise.
And for the family, what's the ripple effect there?
It's equally significant. First, there's just immense peace of mind. Knowing your child is safe, they're happy, they're getting expert care. It allows parents to function, to work, manage other responsibilities, take care of themselves. It's a huge weight lifted.
Fights that caregiver burnout.
Absolutely. And then there's the reduced burden. Just think about the logistics. Having everything, nursing, therapies, activities, often even transportation with a medical escort, all handled by the PPEC. It eases that immense logistical and emotional load.
The transportation is often included.
Very often, yes. Especially for Medicaid-eligible kids. Many centers provide free transport. And finally, many centers become a source of community and resources. They might have family resource specialists, offer educational workshops, connect families to support groups. You find community with other families going through similar things.
That sense of community must be invaluable. So, okay, if you're a parent, and this sounds promising, what's the actual process? How do you get started?
It's usually designed to be pretty straightforward for families, thankfully. Step one is typically the physician referral. Your child's doctor prescribes PPEC services. Then the PPEC team does an initial assessment. They look at your child's specific needs, medical, developmental, and work with you and the doctors to create a personalized plan of care.
So parents are involved in that plan.
Oh, absolutely. It's collaborative. The plan outlines goals, treatments, everything tailored to your child. Then you definitely want to take a facility tour. Go see the place, meet the staff, get a feel for it.
And the cost aspect, that's always a big question.
Right. The good news is, for eligible children, most PPEC services are 100% covered by Medicaid. No out-of-pocket costs. And the PPEC staff usually handles all the paperwork, the authorizations, coordinating with doctors and insurance. They really try to take that burden off the family.
That's a huge relief.
It is. Once everything's approved, your child can start attending.
Now, here's something I think parents are really curious about. What does a day actually look like for a child there? It must be a careful balance, right?
Exactly. It's structured, but also really engaging and fun. A typical day might start with arrival, health checks by the nurses. Then throughout the day, you'd have individualized therapy sessions woven in. There are nutritious meals, support with feeding if needed, lots of interactive play, sensory activities, developmental groups, all tailored to their age and abilities. And then at departure, parents get daily updates on how things went.
And safety, obviously paramount.
Oh, absolutely. Safety is number one. You've got highly trained staff, really low staff-to-child ratios, sometimes like one staff member for every 3 kids, which is amazing.
Wow, that's low.
It is. Plus, a strict infection control, facilities designed for medical safety, emergency plans, Everything's built around keeping these kids safe and well.
And you mentioned flexibility, too.
Yes, there's often a lot of flexibility. Up to 12 hours a day. Some kids go before or after school. Some might only attend a few days a month just to maintain their services. It really adapts to family needs. And kids can attend right up until they turn 21 with regular reevaluations, usually every 6 months, to make sure the plan is still right and they're making progress.
The stories you hear from families are just incredible, really transformative. We heard from one mom who said her daughter just wouldn't be where she is without her PPEC. They gave her the focus, the right medication timing, made her feel so loved. She made progress they never thought possible.
It makes such a difference.
Yeah. And another, a foster mom, talking about how the staff knew her sons, who have complex needs, so intimately, like they were family, giving that special attention.
That connection is so important.
We also heard about twins, babies actually, who learned to crawl and stand at their PPEC milestones they hadn't hit before. And another parent who specifically chose PPEC for the socialization, not wanting to use the school system yet, called it a godsend after a really tough year for their family.
Yeah, these aren't isolated stories. We see kids achieving major things, walking, eating by mouth, interacting more. It's really powerful to witness.
Now, for our listeners who might be in Florida, we did want to highlight an excellent option there that seems to embody a lot of what we've been talking about, OhanaCare PPEC.
Yes, OhanaCare. And Ohana, as many people know, means family. That really reflects their approach. They serve medically complex kids from birth through age 20 down in Lauderhill, Florida. Their whole mission is about creating this safe, enriching place where kids can thrive medically, emotionally, developmentally. And just as importantly, giving parents that peace of mind, that freedom to work or rest or whatever they need.
What kind of services do they offer specifically?
They provide that daily skilled nursing care we discussed, comprehensive therapies right on site, physical, occupational, speech, and behavioral therapies too, plus structured developmental activities. And they offer free wheelchair-accessible transportation for families eligible through Medicaid.
And covered?
They are 100% covered by Florida Medicaid, which is key for many families. But they also accept various HMOs, CMS plans, and private insurance. They're state licensed, accredited, built for safety and comfort, and they really encourage families to come tour, meet the team, see the facility.
So wrapping this up, it really seems clear that PPECs offer this unique, comprehensive solution. It's not just one thing, is it? It's blending that expert medical care with therapies, adding in crucial socialization, and wrapping it all in invaluable family support.
Exactly. And maybe if we step back for just a final thought,
Yeah.
connected to the bigger picture, PPEC centers aren't just about managing medical conditions day to day. They're really about giving children back their childhoods,
Yeah.
and giving families that essential support system they desperately need to thrive, not just survive.
Yeah.
It really transforms lives, not just the child's life, but the whole family's dynamic. It builds resilience, community.
So if anything we've talked about today has resonated with you, if you're thinking this might be a fit, we really encourage you to consider if a PPEC could be right for your child. The best first step. Talk to your child's doctor, their healthcare provider. Explore the eligibility. See what options are available in your area. Remember, just gaining this knowledge, understanding what's out there, that's the first really powerful step towards finding better care and support for your child and for your whole family.